As vital members of any healthcare team, pharmacists can have a significant impact on diabetes care and education. Pharmacists may be in a position to identify people with diabetes, offer advice on their condition, and encourage them to seek appropriate medical care. In recent years, the role of pharmacists in diabetes care has expanded in countries throughout the world. Because of the rapid expansion of available therapeutic agents to treat diabetes, the pharmacist's role in caring for diabetic patients has expanded. The pharmacist can educate the patients about the proper use of medication, screen for drug interactions, explain monitoring devices, and make recommendations for ancillary products and services.
Pharmacists can identify those patients who do not know that they have diabetes or go undiagnosed due to inadequate access to healthcare. Pharmacists can help identify patients with diabetes through screening and should target patients who are high risk, such as obese, older individuals with a family history of diabetes, or women with a history of gestational diabetes. Screening should include the pharmacist providing a fasting blood glucose reading in a suitable and private area of the pharmacy and interpret these results to the patient. Lifestyle modifications and dietary recommendations should also be discussed with the patient in order to lower the risk of developing diabetes sooner rather than later.
Pharmacists are an untapped resource in today's healthcare system, untapped by prescribers making treatment decisions, and untapped by patients who might benefit from education and advice about diabetes and the role of insulin. Pharmacists have frequent contact with patients and are critical in helping patients with diabetes manage their disease. Pharmacists are able to monitor the progress of people with diabetes in their efforts to achieve desired treatment outcomes. Although the role of the pharmacist in monitoring diabetes is not well defined, it includes determining whether physician recommendations and testing for patient self-monitoring are meeting the goals set. The pharmacist can monitor the patient's blood glucose readings, keep a track of the values, and recommend changes over the course of the treatment. Pharmacists can explain laboratory values and interpret recommendations to healthcare providers on the appropriate course of treatment. Importantly, by monitoring a patient's health progress, pharmacists are able to develop relationships which help to ensure quality outcomes of care. This can assist healthcare providers in determining whether people are following a treatment plan that will improve their care outcomes.
Patient education is one of the pharmacist's key roles. Because of their easy access to people with diabetes, they are able to answer questions and offer guidance on the proper use of medications and testing supplies. Because pharmacists can offer education to diabetic patients and healthcare providers on available medications, a pharmacist is a useful tool in empowering patients to take charge of their condition. Pharmacists can educate patients on how diabetes drugs work and how medications interact with one another. Pharmacists can address the adverse effects and possible side effects specific to each patient's therapy. Education regarding the acute and chronic complications should be given along with each prescription to remind patients of diabetes' long-term effects. Pharmacists providing counseling enhances the patient's compliance and improves the quality of life outcome in diabetes. During their contact, the patients can ask the pharmacist any questions they did not ask their physician and can get further information regarding diabetes.